Digging deeper into a serious health alert we first told you about yesterday, the Albany Med Health System is warning it may soon be out of network for CDPHP customers. And it's all over roughly $40 to $50 million Albany Med says CDPHP owes. New tonight and only on CBS 6, we sit down with representatives from both sides to find out exactly where these talks stand.
They're doing this in the public eye because it's a negotiating, it is a bullying tactic.
I think it's disingenuous to refer to Albany Med as being a bully.
CDPHP and Albany Med at odds over $40 to $50 million that Albany Med says CDPHP owes them for the year. It's money they say stems from an adjustment to the Medicare wage index. That determines how much money is paid to hospitals for care of people who have Medicare or Medicare Advantage.
All other insurance companies that pay us have continued to pay us, included at that new rate. CDPHP is the only one that's not been able to.
Albany Med releasing a statement Thursday essentially saying it's time to pay up or it may drop CDPHP coverage altogether. That's a move that CDPHP says wouldn't be smart since they make up half their business. CDPHP also says paying that amount would have bad outcomes.
If we were to pay what Albany Med is suggesting we do, not only does CDPHP go away, but you're going to see a massive increase in your insurance premiums and a massive reduction in your benefits.
They say they've been in talks for months, and those talks happen daily or weekly, even as both sides released dueling statements in the last 24 hours. CDPHP finding it suspect that Albany Med put out their statement in the midst of November, the open enrollment period for insurance.
It's a vulnerable time for consumers, but then also seniors to be choosing their benefits. Putting patients in the middle of these contract discussions is completely inappropriate.
But Albany Med argues open enrollment makes it the perfect time to advise the public of what's going on behind closed doors.
Because now we're in the middle of November and we are in the open enrollment period, we certainly have an obligation, I'd say a duty, to let the public know that this is not resolved yet and they may be out of network.
Well, ultimately, both sides agree they want to reach some sort of agreement, and they have until the end of the year to do it. After that, there's also a 60-day, quote-unquote, cooling period when they can continue to work toward a Hail Mary agreement. Albany Med's CEO also says even if they were to drop CDPHP coverage, those with that insurance could still receive care in the emergency department at Albany Med. Their elective procedures, however, would need prior authorization.